Good morning, everybody, and welcome to the live stream educational series from the InMode University site. My name is Chris Chia. I'm your moderator and director, together with Lisa Mettler, Justin Ross, and Ryan Windes behind the board. We'd like to welcome you to Dr. Daria Hamrah's beautiful office here in Northern Virginia, Washington, D.C. area, and his excellent staff. In addition to Dr. Hamrah, who's a triple board certified cosmetic surgeon, internationally sought after speaker, as well as a former academic who now dedicates his craft and his energies towards providing the highest level of cosmetic services to his patients, along with his great staff, including Diana Pong, his office manager, Tatiana, his master esthetician as well, and Dr. Brian Allman, his fellow for here. Daria, thank you so much for having us.
Hey, so great to be here, and thanks for having me. I'm really excited.
Could you just tell the audience what we're going to focus on today?
So today we're focusing on both Morpheus body, Morpheus face, as well as NeckTite, FaceTite, and AccuTite. We're going to use all modalities. And the first patient, we're just going to use the Morpheus body, doing some lipolysis and some cellulite treatment of the lower abdomen and lateral thighs. And on our second patient, we're going to do neck tightening, face tightening, as well as Morpheus8 to augment the effects thereof.
Fantastic. We encourage the audience in the live portion to text in their questions, where Lisa and I will field them and translate them for Dr. Hamrah in real time so that he can focus on his clinical demonstrations. We also love to acknowledge and appreciate Dr. Hamrah's patients today, whom he will introduce individually later. And without further ado, we're going to start with the didactic portion with Dr. Hamrah. Please take it away.
Thank you. Hi everyone, this is Dr. Daria Hamrah from NOVA SurgiCare here in McLean, Virginia. Welcome to today's InMode University live event. I'm very excited to be here to have the opportunity to share some of my experience with these RF devices with all of you. Today in particular, we're going to have examples of two patients of Fitzpatrick type 4 and 5, and we're going to show an example of Morpheus body to treat lower abdomen and lateral thigh cellulites, as well as face and neck-tight procedure in combination with Morpheus8 on the face for the typical gap patient. And I'm excited to show you my techniques, what works in my hands, and hopefully you can get something out of it. So without further ado, please cue my slides, and so we can talk a little bit about the principles of radiofrequency and the history. So I want to first thank the production team with Dr. Chia, with Lisa, Justin, Ryan, my fellow Brian, my manager Diana Pong, and my master esthetician Tatiana. Before I'm going into the nitty-gritty, I want to quickly talk about radiofrequency and the science of it. So radiofrequency is essentially assisted lipocoagulation using heat and energy, which without Tesla, we wouldn't have had, who's the father of alternating high-frequency current, we wouldn't have what we have today. In particular for the surgeons in the audience, all of you have used the Bovie cautery. And it was William Bovie from Harvard University who developed the first electrocautery device 100 years ago, believe it or not. And Harvey William Cushing demonstrated the first utilization of the Bovie cautery in 1927 at Harvard University. So the science is really not new, it's just the application we have today is very innovative, and I'm really excited that we have this today. So RF essentially is a spectrum of the electromagnetic wavelength, and it ranges from kilo to gigahertz. Just a little bit physics here. And there's multiple radiofrequency devices. We're going to focus today on obviously Morpheus8, which is the fractionated bipolar transdermal, as well as the face and neck type. The concept of radiofrequency technology is soft tissue collagen shrinkage as well as lipolysis. And you can achieve that through volumetric heating of the tissues. And science shows, subdermally, you can heat the tissues up to 70 degrees Celsius and up to 44 degrees the skin, because higher than that you will get burns. We're utilizing the tissue thermal effects of the radiofrequency technology, and we know based on research that we can achieve collagen contraction at temperatures up to 70 degrees safely and effectively, as well as skin tightening at 40 to 42 degrees without burning the skin. So it's very controlled, it's volumetric heating, and we use devices like Morpheus8, body and face. The differences, as you know, there are different depths that can be achieved. This picture shows kind of a schematics of the depth of the needle, so the top layer being epidermis, and then you have the papillary dermis, you have the reticular dermis, and you have the fat, and then the muscle. So a lot of people ask me what Morpheus does, whether you're going to dissolve fat or not. Well, it depends on the depth, as you can see from the anatomy. In essence, you can achieve a full thickness subnecrotic heating, which achieves a large contraction zone within the epidermis, dermis, and the subcutaneous adipose tissue. And really, we're taking advantage not only of the immediate contraction effects, but also of the inflammatory cascade that sets off, which then increases the production of TGF-alpha, TGF-beta, platelet-derived growth factors, vascular endothelial growth factors. All of those contribute to the long-term healing through those areas that you see that we target in the dermal and subdermal tissues, where not only we have a short-term contraction and effect, literally you can see results immediately, but also long-term effects due to the inflammatory cascade that it sets off. This slide is very important. It's important to understand the energy level, the association of the energy level to the coagulation zone. So it's important to know, especially today, we're going to talk about it, when you get close to the epidermis, you really want to do on a pigmented patient, you want to choose your energy levels wisely, just because the higher the energy, the larger the radius of the coagulation zone. And if you're, let's say, you're 1 millimeter or 2 millimeter deep with the needle, you need to know that, for example, at energy levels of 60, you will have 1.5 millimeter of coagulation zone, and that's when you get into the epidermis. So we're going to talk about that, but this is very important. Difference between regular microneedling and Morpheus8, it's really obvious. The bipolar technology, it really helps us to get the volumetric heating throughout the skin. And this is a traditional, you see the heating is really just at the tips of the needle, and the thermal effect is very limited, as opposed to the mechanism of action of the bipolar, which you have a full thickness all the way from the top of the skin down to the length of the needle length. And histologic slides can show us really the changes in the collagen and elastin fibers, the restructuring, and the effect it has. And here you can see only 14 days after treatment, the collagen, neocollagenesis is starting to kick in within around the coagulation zone that we created. This is just the different Morpheus lengthened devices. We're going to go over the different tips. You have essentially the regular Morpheus8, as well as the Prime, which is just a smaller, and then the body, and also then the resurfacing, which we're not going to utilize today, but we're going to talk briefly about it. Different operation modes. You can cycle it, meaning after one hit, you heat up the tissue and then the needles retract, or you can have fixed. You can basically control how long you're going to heat the deep tissue, and you can obviously stack the energy using automatic retraction of the needles at a certain energy level, which we're going to talk about, which is actually very important for the cases today. And this is also a very important slide here that depicts the biological effects that we just briefly talked about. But if you can see the heating stimulation at 40 degrees, which is at the negative electrode that touches the skin, all the way down to the tip of the needles, you can see how the heat is so controlled that without damaging anything, you can actually create the effect that you want. And the coagulation zone we talked about is based, the radius thereof is based on the energy you choose. So knowing what you're trying to treat, where in the body you are, based on the thickness of the skin, is essential to get the results that you want and have also safety guaranteed. And this is again the cascade of events from the time you penetrate the skin with a needle, you deliver the energy, you have increased enzymes, cytokines, all the mediators of the inflammatory cascade starting to kick in. And then after like 4 to 7 days, when the erythema goes down, the initial inflammation goes down, then you have the neocollagenesis starting to kick in. And as you all know, from if those of you who've been using lasers, you know how that sometimes take 2 months all the way up to 6 months. So I always tell my patients, if they love what they see immediately based on the collagen contraction, that they're even going to love it more later on. The other mode I love is the burst mode, where the needles penetrate the skin and retract from the skin with each pulse. And what I like about it, you really don't need to do multiple passes. So within one pass, you get the full thickness stacking of the different depths and the energies you choose, which becomes important today with our Fitzpatrick 4 and 5 patients to reduce the effects of the needle injury to the epidermis, where we just want to heat up the reticular dermis and dissolve or cause lipolysis. And again, this shows the Morpheus body. You can choose, these are the depths and how you can get this volumetric healing. And today, this is the first time we're showing these slides about Morpheus body 3D. This is very fascinating. So what I love about InMode is the constant innovation. It's you already have a great product, better than anyone, and then you even improve it. And the 3D technology, basically, if you look at you have, let's say, 40 needles, not all the needles start bursting energy at once. So you have the internal 12 needles, and then the middle, then you have 24, and then you have 40, and they go sequentially, like within milliseconds, however. And the premise is that in this depicts how it sequentially radiates the heat. And the premise of that is, if you look at the coagulation zone on the right side, the energy, the heat, would otherwise, if all needles heated up together, would bounce off the coagulation zone and wouldn't radiate effectively to the negative pole. So by doing it sequentially, you give the tissue a chance, the coagulation zone a chance to cool down, so that the rest of the energy can move up to the negative pole, so you can get more effective volumetric full thickness heating. So I love that, and I'm excited to be able to show that to you today. Now, anesthesia, really, I mean, most of you have either found or heard a way that works for you. Ultimately, patient comfort and safety is important. You can use topical anesthetic, you can use local anesthetic, you can use nitrous oxide. It really depends on your patient, on their level of comfort, apprehension, etc., etc. It's good to have all options there because you don't limit yourself. Topical anesthetic, again, depends on the concentration you use. You might have to leave it for 30 to 60 minutes. I like mesocaine. My master esthetician, she does a lot of the topical. It's just important to remember the dose, not to overdose the patient and cause lidocaine toxicity, especially when you use multiple modalities. As far as the pretreatment, is essentially the same principle of laser resurfacing, of any dermal treatment that you perform, for HSV. I prophylactically give my patients acyclovir if they have history of cold sores. It's important to clean the area properly if you use topical anesthetic, either with some rubbing alcohol or some HIPAA cleanse. It's important to clean all of that very nicely. And you can also apply some test spot to see how the skin reacts before you start buzzing through. The treatment parameters are, again, depending on the skin type, on the problem you're trying to solve. Again, there's many problems that you can solve with Morpheus8, for example, and as well as the color that we just talked about. So those we'll talk about during the procedure. It's important to know though, let's say when you stack or use burst mode to lower the energy level by about 20%, and I'll show you my settings, and you can go higher with your settings if you do cycle and multiple passes, just because the tissue has time to relax. And of course, only over bony areas or over areas that have very thin subdermal tissues, you want to be more conservative, because really the tissue thermal effect really targets the fibroseptal network and the adipose tissue, and if you don't have much of that, you don't need to use much energy and much depth. So it's important to also think what we're doing and not just use this as a cookbook, because you can easily forget the cookbook. And in general, when I treat dark skin, which we're going to do today, I reduce the energy as I'm getting closer to the epidermis, again keeping the radius in mind. If you have deeper lesions such as scars or wrinkles in the face, I even go all the way down to the SMAS, and I will show an example today. So higher settings, I only advise if you've done some cases already with normal recommended depths, and I will also mention the caveats there. Importance is the application, the firm pressure to get good coupling, make sure the negative electrodes are in full contact to the skin, so you can not only effectively volumetrically heat the skin, but also prevent some damage like scraping of the skin or heating the epidermis if the needles aren't penetrated fully through. You might get those skin bumps that you can see on that picture. So there's a proper technique, which I'll also demonstrate, is important to avoid these types of bumps. Good news is most of these things are temporary. You just have to walk your patient through it, but first you have to know why they occur. So firm pressure, good contact is the key with Morpheus, and you don't want to slide, so give the tips a chance to retract before you move. So you have to really be patient. And we already talked about the 3D, Morpheus 3D, the new tip. One of the things you want to make sure that when you treat the skin, that if you see any gaps, to treat those. You don't want to leave demarcation zones, and as well as proper stacking and utilization of the choice of energy, whether you stack, burst, or cycle. Treatment conditions. Now there's two different conditions, depends on what you do. A lot of the stuff that I do are combination, like I use FaceTite, I use Morpheus, I do liposuction. Most of my patients need variety of treatments. But let's say you just, my esthetician, she wants to improve just the skin or do some treat some cellulites. You don't really need, or acne scarring, you don't need multiple modalities. So then you have to understand, if you don't have tumescent, for example, you don't have as much cooling, you have to make sure the patient is numb. If you don't have tumescent, you don't have the anesthetic effects, and you have to choose your anesthetic wisely. In general, when you have tumescent, obviously you have better turgor of the subdermal tissues. Coupling is much easier with Morpheus when you have the turgor that the tumescent provides to you. There's less sensitivity to these temporary marks that you have, and you can use higher settings because number one, patient is numb, number two, you can't overheat, and as a matter of fact, you want to use higher temperatures because you want to counter the tumescent effect. So let's talk about some results here. This is a patient that before and after she had under eye Morpheus8 treatment. This particular result is not my slide, but you can really see I get similar results, which I will show you. You can see significant reduction of the rhytodosis of the lower eyelid and the malar mountain area. So this is almost no downtime, and it's incredible. I used to get these results only with my laser, and now my esthetician can do these. And here again, you see the significant clinical difference that it makes, and for some patients, this is all they want, and that's why it's important to choose your patients wisely. I use it a lot. Also, my esthetician uses Morpheus8 a lot for acne. To me, this is like the most underutilized patient or treatment for Morpheus. If you understand and just review histology and anatomy, knowing where the sebaceous glands are, they're basically in the reticular dermis area, and you can target them with Morpheus. You heat them up, you will stop production of the oils and debris that or clogging of the pores that will contribute to acne. And these results are after 2 or 3 sessions. This is a case that I did. I did 3 passes at 3, 2, 1, a power of 18. You don't have to, when you treat the lower eyelid, you don't have to go with a power too high. Remember, the eyelid skin is the thinnest skin in our body, so that's how you have to choose your settings wisely. So it's not really a cookbook. And you can see that this is just one treatment. This is from acne treatments. In the middle, this is the patient with active acne. To the left, it's a patient that had acne and now she's 3-4 months post active acne, and where Morpheus8 really helped to smoothen her skin, getting rid of the discoloration. And on the right side, you see a patient that had acne 20 years ago and she wanted to improve her skin texture. All of these are only after 3 sessions. This is a patient that had Morpheus8 as well as the resurfacing. You can see these, to me, if I look at this, this is better than the Erbium YAG result. This is close to a CO2 result to me. So, but this is only achieved through certain settings. Stretch marks, they only work really better if you are in the early stages of the stretch mark, when it's the erythema phase, not so much for the atrophic scar. You can even do lipolysis for bra lines. Cellulite treatment, which we're going to show today. We're going to talk about rhytidosis around elbows, knees. So for a lot of these patients, this is a fantastic result. They're very happy. And again, an example of cellulites. Going back to FaceTite now, these are things that really transform my practice, especially for the gap patient. You can see you have the different hand pieces with different diameters. With the AccuTite, it's a 22 gauge, FaceTite, 18 gauge. These are the things that I use in the face. And of course you have the BodyTite. But if you look at the depth of treatment and the volumetric heating you can apply, understanding anatomy, you can choose your hand pieces based on where in the skin you are, and we're going to demonstrate that. And again, the positive probe, which is down in the dermal subdermal tissues, heats up to 70 degrees, and the negative probe that is also measuring the skin temperature 100 times per millisecond actually prevents overheating of the skin. And this is pretty fascinating how technology can help us to be safe. These are different facial zones for FaceTite, which we're going to talk about, but in general, this is a good slide if you want to refer back to it. The amount of tumescent that I typically use, these are the insertional ports, which we're going to talk about, but you can refer back to these slides if you want to use them as a guide. They're in the publication and the references down there. So I recommend you to read these publications and articles so you have a good reference, because I get these questions a lot and all information is there. And this is a nice picture that shows a fibroseptal network. That's where the magic happens, guys. So this is the tissue thermal effects. That's where the main tissue thermal effects are. So if you keep that slide in your mind as you're treating, you can. I love it because I can essentially visualize what I'm doing, and you can. That's when the artistic comes into place as you're treating. This picture shows the volumetric heating and the area, and you have a gradual heating. This is instant. You can get an app with a heat camera, hook it up to your iPhone or iPad, and you can see it while you're treating the patient. This really shows the contraction that it causes. 42%. For the surgeons in the audience, you guys use electrocautery straight on the tissue. We dissolve fat, we contract tissue, especially when we do blephs, for example. You can see that happen. So for me, that was all I needed to know, and the rest is history. Literature goes, if you're interested to know the difference between radiofrequency and other laser-assisted liposuction, There is a great study out there that shows the difference. So I recommend you to read that, in particular if you're on the fence or you get questions from your patients. These studies help me a lot to explain things to my patients because they ask me about the differences. So these articles are there, the references there, they're on the website, so I recommend you to read them. And there is a lot of literature that shows in general the settings that have worked based on the BMI, based on the age. I also recommend you to read those. And as far as complications, again, this is so safe. I could tell you the only complications that I personally had that were only temporary, they were mainly skin bumps. I never had tissue necrosis or anything. I mean, it's really, of course, they're based on your technique, but in the literature, as you can see, most of the complications are temporary and resolved within 2 months. Contraindications, obviously, autoimmune collagen vascular disease, smokers, anti-inflammatory, basically the basic complications that we have for laser or any dermal treatments or surgery. Pacemaker, just make sure you consult with the cardiologist or the device company, make sure there's no interference. Indications, obviously, skin tightening and lipolysis, and I'll show you a couple of examples of the perfect patient, which is known as the gap patient, which in my practice actually consists over 80%. So in the past, over 80% of the patients I really couldn't treat. I wasn't big on really fillers, liquid facelift. We now know that it's not the solution. Every week I have 3 or 4 patients that come from all over to have fillers dissolved only for me to do the right thing. So if you're still doing liquid facelifts in your practice, you ought to look at some of the science, latest science out there. Maybe it will change your mind. So who's the gap patient? They're not ready for surgery, whether it's based on their work or the family situation or their life, whatever that is. They can't have the downtime or not the finances. Some patients just want minimal improvements. Others that had surgery, which we're going to have an example of a patient that had prior surgery and we're just going to improve the outcome thereof. And also finances. So this is an example of a filler versus aging. So in my philosophy is tightening, not overfilling. We have different modalities. Obviously, you can pick your poison. Ultimately, your patients' faces and bodies are your reputation. So in my practice, play the long game. And this is Courtney Cox is a perfect example. She had her face overfilled, trying to avoid surgery. So she's a gap patient by definition, but she was treated with the wrong therapeutic, which was overfill. She came and said, I don't look like myself, I look like a different person. I 100% agree with her. And she went and dissolved her fillers, and to me, she looks 100 times better compared to the middle, and she's super happy now. So she would be a great candidate for FaceTite, NeckTite, Morpheus, and then ultimately, she may not have surgery. So these are some examples of my gap patients. To the left, you have a 40-year-old, 50-year-old, and upper 50s. My focus area is more the patients in their 40s, sometimes 50s. So you look at the 50-year-old, she looks 10 years younger for her age. She actually looks like she's in her 40s, to be honest. So that's why she made that category. And the patient on the right, a 57-year-old, she really doesn't want to have a facelift or a neck lift. So I even explained to her, I manage her expectations. I told her, don't expect the facelift result, and Kim gets improvement, and I'll show you the results. So this is our 52-year-old. All I did for her is NeckTite, okay? These are some of my first cases, and that's really where I saw the magic happened. And you can see the beautiful jawline in the 3/4 view. Significant improvement of the jowling, which amazed me as a facelift surgeon. And most of my facelift, I do deep plane facelift, so I really have very high standards and expectations of myself, and so I wouldn't really provide anything less than that to my patients. So these are the things that this patient was ecstatic. I didn't expect this result, so it goes all to the power of the technology. This is a 44-year-old that I just did a NeckTite, and you can see the angle of her cervical angle is significantly improved, and the submental area also. I mean, I wouldn't have believed that I could get this just with heating the tissue. And this is our 57-year-old. You can see improved jawline, the cervical angle improved more than I thought. She was happy. And again, if she had expected the facelift result, that wouldn't make her a good candidate. So expectation management is key when you choose your patients. These are some other results of older patients. This patient in her 60s, but you can see significant improvement. And that's a combination and the power of combining the FaceTite with the Morpheus8, because you can even get more tissue and dermal contraction. And in a patient like that, you really don't want to do much lipolysis. You really want to do more heating and dermal contraction. There's a patient, she's 41, very young patient, bothered by her jowling and a submental fullness. And all I did for her is NecTite, that's it, no FaceTite. In hindsight, I would have done FaceTite on her, but again, these are cases that I learned through and I saw the power of the technology. And if you look at the right side, geez, I mean, that, if anyone had shown me that result, I would have thought she had surgery. So I was even surprised. And again, it goes back to proper setting and expectation management. Again, we have combination patients. I really categorize them in patients that have mild laxity, fullness, moderate laxity and fullness, and severe laxity and fullness. And these are all patients in their 30s and 20s and 30s. And these are great candidates. If you want to start off with this is who I would start off with. And so again, in this patient, 30-year-old, I just did NecTite, and we achieved all she really wanted, which is improving her jawline and getting rid of the submental fullness. Combination procedures for patients with mild fullness and laxity, where I do some liposuction as well as the NecTite. And in her case, I also did a buccal fat removal, which eliminates the fullness in the lower face. You just want to pick those combinations wisely based on your diagnosis. So just don't do a cookie cutter for everyone. This video kind of quickly shows, this is the same patient that had NecTite, liposuction, and buccal fat excision. I call it my facial slimming procedure. I usually debulk the fat a little bit before I do the NecTite, and here you see me doing the NecTite, and then after I do the NecTite, I also remove some of the coagulated fat. I aspirate it just so it doesn't sit around and cause a lot of inflammation. And this is a major transformation. She was extremely happy with the results. And these things take me only 30 minutes, and they go back to their normal lives literally 48 hours post-op. So this is, to me, in my practice, that has really transformed my practice. And in this patient, I also added a rhinoplasty because she actually came to me for rhinoplasty initially and then asked me about if I can improve her fullness. And that's what I did, NecTite, neck lipo, and buccal fat. Why? Because she had the indication. She had fullness of the lower face, fullness of the neck, and look at that transformation. I mean, she looks stunning. And for this, let's do that minus the rhinoplasty. Let's just say she just had the neck procedure. 30 minutes to get from top to bottom, show me something else. This is a typical middle-aged lady that just wanted to look refreshed. She didn't want to have any major transformation. She didn't want to have surgery. She just wanted to look refreshed. She wanted to have a day at the spa. So treatment plan for her, FaceTite, AccuTite, NecTite, Morpheus8, and PRP. These are my markings, which we're going to go through at live surgery, so I'm not going to talk too much about it. So what I did for her, I did FaceTite and NecTite. I even did her nasolabial folds, marionette lines, and then I did Morpheus as well to get full transdermal tightening, and then injected some PRP and applied some PRP topically over the Morpheus channels to improve the regeneration of the skin and the healing. And you can see on the lower eyelid, I did AccuTite for her. You can see the significant improvement. This is just one AccuTite treatment. I mean, I wouldn't get these results without surgery or a laser. With the AccuTite, though, you have to understand that they get more swelling, so the recovery might be a little longer, like 4 or 5 days. And so the result, you see, she got exactly what she wanted. She wanted to look refreshed, and here we go. She looks refreshed. Minimum downtime to none, and she's super happy. And you can see in general, she looks probably 5-7 years younger without any surgery. She's middle-aged, perfect candidate, right? Look at her skin. The Morpheus really does magic, not just for the vibrance of the skin, but also the texture. This is a combination procedure of Morpheus8 with CO2 laser and PRP. I use that a lot for older patients. I love the combination of the Morpheus8 with CO2 because I can treat this surface of the skin with CO2 and I can treat the deeper dermal tissues with the Morpheus8. If you don't have CO2 in your office, don't worry. You can get the same results. Just use your resurfacing tip and that does the magic too. Just make sure you do the resurfacing on Fitzpatrick 1, 2, 3, maybe 4 with pre-treatment with retinols and hydroquinones, just like you would do for laser treatment. This is the last patient where I did a combination procedure, 50-year-old beautiful lady. She had severe nectosis, hypoplastic chin. So a lot of times a chin hypoplasia contributes to the laxity of the neck. And no platysmal banding is a perfect candidate. So you also have to consider platysmal banding, whether there are banding or not, because you could actually make the banding look worse if you don't consider that, or if you're too aggressive with the lipolysis, or do liposuction. So here's the before and after. I mean, this is an amazing transformation. You can see her jawline. I mean, her whole lower facial harmony completely changed and transformed. And if you look at the neck, that's just with NecTite, guys. This is just NecTite and a little liposuction. And some people tell me, well, you did the genioplasty. Well, you can move the chin backward. That doesn't explain how she has the jawline in the back and the gonial and antegonial notch area. So that is really testament to the volumetric heating. So again, thank you very much. And I hope this brought you some value. And now we're going to get to some live surgeries. All right, everybody, welcome back. We're here with our beautiful patient, Erica. Thanks for being a good sport, Erica. Like I said, the first patient, we're going to treat the cellulites, in particular her lateral thighs, and we're also going to do some lipolysis, some shaping, as well as later on she's going to turn and we're going to do her lower abdomen. She's a Fitzpatrick type 5 to 6, and you know, like I said in my talk, it's important to stay away from the epidermis. So also another important factor when treating pigmented skin is important to minimize the entrance of the needles as much as you can. So therefore we're going to use the burst mode. So we're going to do one pass and then we're going to stack it at 7, 5, and 3. And you know, if you're in the beginning of your journey, of your Morpheus journey, I recommend you to say lower on the energy. You know, you can go all the way up to 30 on burst mode, and remember, when you do burst mode, you want to stay about 20% lower than what you normally would for cycle. And so we're going to use an energy of 25 and single pass. The good thing about single pass also is that it just doesn't take so much time. You know, you do one pass and you're done. Now, in some areas, especially in her lower abdomen, we're actually going to do the burst mode, but we're going to do 2 passes. And in her lateral thigh, just because we're just doing cellulites, 1 pass would suffice. So, you know, we're going to show some before pictures. So just because she's laying down now, you can't really appreciate that when the patient is laying down. You know, if you know. Or improve the appearance of the cellulites. And you can do multiple treatments based on your endpoint result that where your goal is, or the patient says, you know what, this is great. Now, this particular patient also is being treated with Evolve X Transform, which is not the topic for today, but just to mention that, you know, a lot of times combination treatments using your radiofrequency devices get you to a better result faster and more effectively. So she's already been treated currently with Evolve X Transform. So in the lower abdomen, we're going to add Morpheus body and for the cellulites again. Okay, so we can get started here. I can get some gloves. And if you have any questions to anything, you can ask anytime throughout this webcast, and just so you can get the greatest value. If we can get the Morpheus 3D handpiece. And so today we're also going to use the Morpheus Body 3D handpiece. Like I told you in the talk before, you can volumetrically more effectively treat and heat up the skin using the 3D sequential heating from inside to outside. Inner 12 pins, middle 24, and then outer 40 pins.
So, Dr. Hamrah, what is your philosophy with this different Fitzpatrick types, and when you determine the power and what you're thinking of achieving versus safety and efficacy? How do you balance those?
That's a great question, Chris. It's funny. Most of the questions I get, they evolve around power, and the reason why it evolves around power, because obviously we want to have the best result with more safety, and in a Fitzpatrick type 5 or 6. The key is you don't want to heat up the epidermis, and once you go to the papillary dermis or the reticular dermis, you want to choose your heat such that the radius doesn't get large enough to affect the epidermis, which then could cause hyperpigmentation. So that's kind of like conceptually, if you understand the key concept of what we're doing, you could basically answer that question based on your patient. So let's hit start.
So basically, you love anatomy, so that is always anatomically based, I think.
Always anatomically based, and also technological. You have to put the technology and anatomy together. And so here, I don't know if you can see, appreciate. So you see, we do 7, 5, 3, and you see that will come through, and then they will sequentially retract at 7, 5, and 3 as I'm keeping my foot on the pedal. See, boom, boom, boom. And those are the bursts that are stacked.
So since it's stacked, obviously, you're getting more coagulation with
we
each
might
pulse.
have to move this.
Hold on.
This is tangled on there, so if you can pass that through, that could. And another thing also, you can, with stretch marks, you see she has some mild stretch marks. With stretch marks is when you treat them early, when they're red and erythematous, that's very effective when you use the Morpheus. Once you pass that stage, you're not going to get those results anymore. So you can treat stretch marks, but make sure they're in the initial phases when it's red and inflamed, and then you get some neocollagenesis. So here, so this is the area we're treating here, her lateral thigh. Now, you don't want to, one of the things also, you don't want to remove too much fat, but you can. So the higher you go with the energy and power, the more lipolysis you will get. And the depth really targets more the fibroseptal network. So coupling is important, and meaning this square area has to be in full contact with the skin. And you also don't want to overlap when you do the burst. How are you doing, Betty? Erica?
Oh,
good.
Can you talk about your, I know you mentioned during your didactic, but your analgesia regimen once more time. I noticed that you use an occlusive dressing
So
as well.
we used a topical occlusive dressing. It's important to limit the amount of it, 1 or 2 tablespoons. Now, how is the discomfort, Erica? Is this from 0 to 10, if you can give me a number?
I would say about 5, 6.
Okay. So a lot of times when a patient says 5, 6, I ask them if they would like more anesthetic.
Yes.
Good. So I'm glad you said that, because I really like to demonstrate that. So if I can get some mesocaine, this is diluted 2% lighter with epi. It's a vial of 20 mLs that we diluted with 250 cc of normal saline. It's important to remember the total dose that you can give. So she had already topical, so we want to be really very conservative with this. That's why I use hyper-diluted mesocaine. And you can do it straight from the bottle, but if you want to blanket a larger surface area, remember you don't need that much lidocaine. So we're going to do that. And can the camera show this here? So this is a triple needle. These are just 30 gauge needles. So when I go, you don't have to go too deep. So a little pinch here, okay? How's that feel?
Feels okay.
Good.
About 1 cc per injection divided 3 ways, would you say, approximately?
Yeah, I do exactly. 1 cc divided by each way, or even less. We already did some topical on her, so I'm going to do less on her. Okay. And again, you don't have to do everything. You just do the area that you're treating, which is really this area here of the lateral thigh. And it actually kicks in very quickly. So within 30 seconds or a minute, patient is anesthetized.
It's an alternative therapy. I've used just a
do?
spinal needle as well, Daria, in maybe a third of the volume of tumescent fluid.
What's that?
Sometimes I use a little bit of tumescent fluid with a spinal needle, maybe
yes, you can do tumescent. I like to do that in the face a lot, or when you do a larger treatment. You can continue here. So we did already this segment here, okay? So just do this here, and then below that, okay?
And from a practice management situation, it's great that you can delegate this to a qualified physician extender. Of course, that's state specific. Here in Virginia.
Correct. So you have to really, see what the laws in your particular state is. Here in Virginia, my master esthetician and my nurses do most of the Morpheus. I usually do the Morpheus when I do it in combination with other stuff that I do. Just logistically, it makes more sense. So we kept fighting about our Morpheus machine, and so now we have enough machines where we can do it more effectively and more efficiently, and we don't have to really compromise. And a lot of questions I get about Morpheus is also how the depth correlates with the energy. And again, the first question you have to ask yourself is, what's the diagnosis and what are you trying to achieve? And the deeper you go, the more fat you will dissolve, and the more you're in the reticular and papillary dermis, the more collagen effect you're going to have and the less lipolysis. But then areas in the body, the thin skin thickness is different, so you have to also know. We can now do this side. Now the audience can't really see this side, but you can continue, keep going here, this area. So maybe we can do some mesocaine. Brian, why don't you give her some mesocaine here, and then Tatiana can treat that.
Dr. Hamrah, do you usually change the settings when you go from topical to injecting lidocaine?
So no, because yes and no. So it's a good question. So my settings are really based on what I'm trying to achieve, the effect I'm trying to achieve. So the reason why this question is tricky is if you do tumescent, you have to account for the tumescent solution that absorbs some of the energy. So you would have to and could go higher. As a matter of fact, you should. Otherwise, you're not going to get the desired effect. And if you just do topical and you have no tumescent, then of course, you use just only the settings that would achieve a given result or significance without the variable of the tumescent. Does that answer the question?
Yes.
Thank you. Also, we would like to remind our live audience that feel free to text in your questions that Dr. Hamrah can answer real time for us. And we're going to continue with treatment.
And again, as far as mesocaine also, yeah, that's good. You would have to see also as far as your state regulations, whether you're as an esthetician, you can do that or not. I mean, a nurse would be able to do that, obviously. So those are kind of things you want to look at. It's really different from state to state. But usually sometimes what I do, if I'm there and I just have done something else on a patient, I already do that and then hand over the patient. So continue the treatment now. So we're going to do this area here, the lateral thigh, so we can then turn her over to do her lower abdomen. And so when we get to her lower abdomen, she's currently getting the Evolve treatment, which is the non-invasive transdermal heating radiofrequency application with the Evolve X Transform applicators, which what I love about them is that they're non-disposable, and also you can tighten some abdominal muscles, which I'm actually doing on myself. So
EMS component.
Yes, it's huge. I mean, for me, and what you need to realize, the EMS portion, obviously will become obsolete if there's too much fat, because you can't really see the muscle effect. But if you don't have too much fat and you can dissolve up to 2 to 3 centimeters of fat with the Evolve, then you can see the muscles pop. So, you got to think about that too. The other thing, the reason why I'm mentioning it, so for her, we're also going to use the Morpheus body to even get more lipolysis in the lower abdomen. So if we're done here, we can ask Betty to turn around.
While we're doing that, there's a question from the audience. Would you just go over your settings again? So we're at power of 25, burst mode of 7, 5, and
Yes.
3 millimeters, correct?
Correct. So again, this is significant just because we want to account or adjust the power and the energy based on the fact that we're using burst mode, because we're stacking the energy. So you want to go 20% lower. So normally my settings are, when I do let's say a lower abdomen, I really go high in the settings and the energy, meaning the depth and the energy. I go all the way up to 60, 65 power, and I go as deep as possible, because you can just pinch and you know how much fat you have. And so you want to get as much of that as possible. And for darker skin, what I like, let's do some mesocaine here, Brian. We're going to do from the belly button down to the pubis, and just limit it to the 10 cc's. Okay? Did she have topical here?
No.
Good. So she didn't have topical here. Great. So Brian, what you want to do, you want to blanket basically from here to here and this area. So again, it's basically augmented treatment. You do the Morpheus8 and the Evolve, you get better treatment. It's not like you have to, but if you can get a better result, why not do it? And so for me, it's always a discussion I have with the patient, see what they're expecting, and then make my recommendations. Ultimately, if you explain things properly, patients typically choose what you recommend, because patients want the best result. And if they don't, you have to see maybe they didn't understand it, or maybe that's not what they actually want. So whenever it comes to treatment acceptance, communication is key. And that's why we do all these events, because the way I started, honestly, I started watching every single video, Chris, and that was a huge help to me. And every time I watched them multiple times, and every time I watched them, I learned something new. It's like a movie you watch. We always, during the holidays, we watch Home Alone, and every time I watch that movie, I pick up something new. And I think I've watched the movie 50 times, but it's just the way it is. So I think as part of your learning experience and learning curve, the more information and the more reiteration of the information is essential, because also contextually it will matter, and it's going to become different, the information that you retrieve, based on your personal experience with your patients. So that's another factor. So I don't treat my patients the same way I used to treat them 6 months ago or a year ago, because it constantly evolves. So let's now, did we do the mesocaine?
Yes.
So Tatiana, you can go ahead and start. And I want to show, I don't know if the camera can show this, the coupling is really key. So Tatiana, as you're treating, show the coupling before you start bursting. All right, here you go. So if you can zoom in here, I want to show something. So here. So sometimes when you go really fast, you might not be able to, you might not have coupled it, or the needles haven't retracted fully, and then you go to the second location, you can scratch the skin. Now this becomes important for a darker Fitzpatrick type. And so you want to really be patient, okay? And the good news is, it's not like you're doing multiple passes and it's a large area. So why don't we start doing from bottom to top, and one of the things to remember is keep it systematic, keep it consistent, so you know what you treated and what not. When you don't use tumescent, you get the pinpoint bleeding, so you kind of know where you are. And see how she's doing it very slowly, because she's making sure that she's not overlapping. If you did the cycle mode, you would want to overlap about 30%. And if you do the burst mode, you don't need to overlap because you're already doing your 3 passes. How are you doing?
Hanging in there.
Hanging in there. So what's your pain from 0 to 10?
Manageable, I'll probably say about 4 or so.
Okay. So I had this done, and 4 means different to obviously different people. And so I always ask patients, so Erica, if you want us to give you more local anesthesia, we can.
Yes,
Good.
yes.
So communication with your patient throughout the procedure is important, just because you want to make it as comfortably as possible. Because you want them to come back, and you want them. That's the only way you can succeed with the treatment. Okay. So she was very sensitive here. We treated that. So
I'm more sensitive towards the
middle.
No, the edges.
The edges. Okay. This is where we're going to stop here. And usually I do it like a centimeter apart or an inch apart.
You also touched upon the new software technology with the 3D, which is great, and the different application of the RF.
Okay, wiping.
From centrally to peripherally, so it's kind of
Yes.
it's like a dimmer switch and a light switch rather than all the energy hitting at once.
Yeah, so if you see, let me see where we are in the camera. There we are. So if you see, the inner circle heats up first, and then it radiates outwards. And that way you don't, the electric current doesn't run into the coagulative zone and can spread more evenly to the negative probe, which is all these metal portions with these grid looking. Those are the negative probes here. All right?
Greatly mitigated arc problems and those kinds of things. It's clinically
yeah, it makes a difference. Effectiveness is, that's what we want. It makes a huge difference in the clinical results, and that's why I love about it. It's not, I like that they don't wait for competition to come up with stuff. You always, compete with yourself, and you have to keep your standards high, and that's what I love about the innovation with InMode. Okay. So in a case like this, you could do 2 passes, or even though you're doing burst, you just have a better effect. So 2 passes is not a contraindication. In the face, which we're going to do shortly on a different patient, I'm actually going to use the Morpheus body tip just because I want to go to the deeper level, so that gives you an idea and concept of how you utilize the technology based on the effect that you're trying to achieve, as opposed to just doing a cookie cutter. And we're going to talk about that. So here again, we're doing 7, 5, 3. So we're going 7 millimeter deep, 5, and then 3, and we have the energy of 25. You could go higher, up to 30, but again, you want to be cautious, especially with darker skin. Just because as you get to the 2 millimeter depth one, you could get into the papillary dermis or epidermis if you go at higher energy level. Okay. Any questions from the audience?
Do you do anything to pre-treat the skin prior to?
I don't, but if you want to be safe, and if you're not confident that you're not going to heat up the papillary dermis or epidermis when you're superficial and you're heating, you need to understand the heat radiates up and could affect the epidermis. So especially in sun-exposed areas, you could pre-treat. I generally don't, based on my choice of energy and depth. So that's a great question. So whenever in doubt, do it. It's good for the skin anyways. The other thing you have to consider with dark skin is anytime you create an insult or injury to the epidermis, which is by virtue of the needle penetrating the skin, you cause an inflammatory cascade, regardless of the radiofrequency or not. And that in itself could cause some hyperpigmentation, which is temporary. And then the pretreatment can mitigate that. But you don't have to. Okay, so we're done, guys. Awesome. Thank you. So I don't know if you can see here. You can see here the marks. If you can zoom in, you can see some of these skin marks. All this is normal. I'll point to it. So you see these marks here? So this is normal. If you look at, yeah, it shows it beautifully. Great resolution. Okay, and that's normal. And those will dissipate, with time. It's important to inform your patients so they're not worried. Anything you see, you have to tell them. Otherwise, they're worried. Last thing you want is someone to go on Google and search something, scare themselves because they have no context and don't know how to interpret that stuff. Okay.
And what do you use post-treatment?
So post-treatment, we're going to use some bacitracin, which we have here. You have to be careful though with bacitracin. I've seen, I don't know about you, Chris, but I see more and more patients with bacitracin allergy.
Yeah, they have a hypersensitivity.
Or hypersensitivity, yes. But you can use, in the face, I love using PRP. You can use PRP anywhere. But again, our target now for her is the adipose and fibroseptal network. You can use anything that's hydrating occlusive like Aquaphor, Vaseline. You just want to make sure, and we can also apply it to her lateral thighs. Okay? So yeah, bacitracin.
Perfect. It's going to come on, please. All right, well, Daria, that's wonderful demonstration for our wonderful first patient of yours. Mm-hmm. And we'll take the time to insert some digital media while we turn the room over.
Perfect.
And we'll be right back with Dr. Hamrah and his staff and the next wonderful patient.
Thank you. Don't go anywhere. We'll be back. All right. So here today, we're going to define the jawline, remove all the excess fat. We're going to, after we remove the excess fat, we're going to tighten the skin with radiofrequency so we can have a more defined jaw. So all this volume is going to shrink essentially like this. Some of it is muscle. We'll see after we remove the fat. And then also she has a slightly under projected chin. We're just going to put a little chin implant to even get her a more defined jawline. The chin implant actually extends. It's not like a cap that goes here like in the old days. It actually extends all the way here and fills in the pre-jowl area. Okay, so the landmarks are the angle of the mandible here, and then here's the inferior border of the mandible. And I do the same thing on the other side. You can't really see it from that angle, but all right. And then these are the sternocleidomastoid muscles. So with the lipo and the FaceTite, we can go all the way down to here, to this level. And also circumferentially it tightens the neck and gets rid of volume, so patients look like they lost 20 pounds. How's that sound?
Amazing.
All right. Okay, so all of this area, we're gonna remove the fat all the way down to here, and her jaw angle to neck, if you come from this side, from the side here, a little further out maybe, this angle will then be more like that. Okay? And I call it non-surgical, but if you want to consider liposuction surgery, I don't really consider it surgery. Because you inject stuff, then filler would be also surgical. Whether you inject stuff or pull something out, to me it's the same thing. We're just removing fat. Hi everybody, welcome back. So this is our second patient. She had a prior history of a neck lift, so she's a perfect gap patient. She had prior neck lift that left her with some fullness in the submental area, more on the lateral side here. I don't know if you can see that. There you go. So it left her with some fullness here. If you can show the pre-op pictures, just because she's laying down, so it's better to see when patients is standing upright. And so what we're going to do for her, we're going to do a combination of FaceTite and Morpheus8. We're going to treat her lower face, and neck, jowls, okay, marionette lines, nasolabial folds with AccuTite, and then we're going to do Morpheus in burst mode. So the reason why we're going to use the burst mode is because we don't. So if you can give me the marking pen, so I'm going to demonstrate. You can put the half sheet on her and drape her. So the prepping is, if you can give me the towels, we're going to, you can drop that, just put the half sheet here. There we go. Just blanket her. And so the prep for this is pretty simple. This came off here. Want to put that on for me, Tatiana? Mm-hmm. Yep, like that. No. It's the other way. Turn it around. Yeah. There you go. So you want to expose the neck, so the inferior aspect of our treatment is typically down here, but not for her. Again, she had already a neck lift done. If she hadn't, then I would go with the necktie all the way down to the lower crease of the neck. Our focus area is the submental and mandibular border area. Can I have another towel? And some towel clips, towel clamps. If you can lift your head up, Betty. Okay, put your head down. And so again, you can do this easily in the office. For the purposes of this show here, we're doing it in my operating room just because of the size, but you could do this in your back office anywhere. You don't need an operating room to perform this procedure. Let's get some HIPAA cleanse to clean her face, and then we'll do our markings. So on her, as you can see, our target is the lower middle face to lower face and neck. The way I normally do it, I do the FaceTite first, the AccuTite first, and then I will follow it up with Morpheus8. The sound you're hearing in the background, that's our PRP spinning. So sorry for the noise. We're gonna afterwards put PRP onto the skin as her dressing.
Michael, you know, the temporary channels are a perfect avenue for the PRP to be
optimized, it's absolutely. It's almost like there were a match made in heaven.
Yeah.
You have the channels, and you want the inflammatory cascade, all the growth factors, a part of the healing factors, kick in, boost up. The PRP helps with that significantly. So just a review of the instruments while while Brian preps her face, I want to show you a couple of essential instruments that you would need. Give me one of the small syringes too. So, I don't know if you can point the camera to here. And maybe an 18 gauge needle is on here. Is that an 18 gauge? There you go. So, all right, so this is really my armamentarium. If you just did a necktie, let's say you want to do tumescent, this is my tumescent solution. I'd use standard Klein's tumescent solution, saline epinephrine, and this 18 gauge needle, it's just my access port for me to enter the tumescent and then introduce the FaceTite probe, which is an 18 gauge, and the AccuTite would be a 22 gauge. And this is my liposuction cannula. A lot of people ask me what I use for liposuction. I like to use the flat cannula, 2 to 4 millimeter, depending on area and accuracy. They're made by Tulip. I don't get paid for saying this, but in case you're interested.
That's down firing, right, Daria?
What's that?
It's down firing, correct? There's
Yes,
holes on the bottom,
and it's very important. Thanks for reminding me, Chris, because you don't want to defat the dermis, so you want to turn it around and aim it towards the platysma. So otherwise, you're gonna thin the skin too much. And remember, you're also causing some lipolysis using the FaceTite probe, so you don't want to defat it much. As a matter of fact, on her, I'm not going to do any liposuction. I just have it here just to demonstrate it. Thank you, by the way. The cameramen are doing a great job here. They never get the credit, so thank you, crew. So let's do some markings here. So the first thing I mark, how you doing, by the way? Good. Would you like to be more sedated, a little more sleepy? Okay. So Brian can take care of that. So what I do, I mark usually the angle of the mandible, which is right below the earlobe. And so we're good. So make sure Brian is not in the view. So you just connect the dots, okay? And I do it on the other side. You can't really see it, but you have to trust me that I'm doing it exactly like the left side. And another thing I do, so once I have to define the inferior border, I mark the marionette line here all the way down. That's kind of like this areas where the marginal mandibular branch kind of curves up. You know, for those of you more familiar with facial anatomy, you know it's a finger breadth below the inferior border of the mandible, and then it kind of comes up and goes more superficially above the platysma into the depressor labii and mentalis area. So I call this here the no-fly zone. You don't want to get into this area. And this area that I circle, I just want to make sure when I'm treating it, I don't heat that area up too much. You could probably make it a little larger here. And so when we do the FaceTite, so I usually mark from the inferior tragus to the commissure of the mouth. And this is the area we're treating with the FaceTite, because you don't want to just treat this area. You also want to treat this area because you're going to have a volumetric contraction. You're going to have this. This is what you want. So if you just heat this, you can get improvement, but you can get even more if you do this.
You're trying to mimic the same vectors as with a facelift.
Correct. Absolutely correct. Which the vectors in the lower face for a facelift are typically along the inferior border of the mandible, and then as we get the mid face, they get more vertical to a kind of more of a 60-degree angle. Another aspect is what we're going to do when we mark the nasolabial fold here. This is really important here, so pay attention. When we treat the nasolabial folds, you want to treat the area just lateral to the fold, okay? Not the fold itself, just lateral to the fold. Two reasons. You're doing some lipolysis here, and you're also tightening the skin in the area to get this effect. So if you've done filler in the past, if you're chasing lines, this is not the same thing, right? So you're going to actually inject it in this area, okay? And with the lower face also, the jowl area, this is the area I'm very aggressive, okay? This is where the money is, guys, okay? So these things are important because you need to focus. And then also in her case, I just mark the problem area. So I don't, because once I do tumescent, it distorts everything. So I don't want to lose these key areas that I'm trying to treat, okay? And again, we don't have to do much with the neck. She already had a neck lift and she has good result from that. But guys, so this is the typical gap patient, right? She had 2 prior surgeries, still some areas that we can improve, and that's why how this comes handy. So I'm just doing the corresponding side. And
I think that's a great point you make about not flattening the nasolabial fold, but going just superior to it, and because you're working on the contractive forces.
Exactly. And then think of what creates the nasolabial folds. What creates a nasolabial fold is essentially a shadow. The shadow is created not by the valley, it's created by the mountain. Okay? You see the shadow in the valley, but it's created by the mountain. So you got to flatten the mountain peak, which is right here. So if you look at it that way, that may help a lot of the audience here. Another thing I would mark in the neck, you can't mark it in her because she had a platysmoplasty. So if they had like platysmal bands, you would mark the platysmal bands. The reason why that's important, you don't want to defat this central zone too much, because you're actually going to, if you defat it too much, you're going to make the patient look older, and that's not favorable. So always mark the platysmal bands. And then again, in a normal case, I would really treat the lipo, the radiofrequency treatment all the way down to that crease here. And then also I mark the posterior border, which is the border of the SCM on both sides. So this would be the area that I would be treating, okay? I hope this is clear. So Lisa can let me know if anybody has questions.
Yes, thank you for that segue. We'd like to remind the live audience to please text in their questions.
You could talk a little bit about lidocaine toxicity and what you use for your 2% dilution.
Great question. I love that question because it's very important. That's the main safety reason. So what I use, I have tumescent here and I have 2% lidocaine here. So what I typically do, I inject the ports that I want to inject the tumescent. Little pinch here, Betty. Just the entrance areas, which is below the border, below the lobule of the ear, right under the chin on both sides. Okay. And also in areas where I'm going to be inserting the AccuTite probe and the FaceTite probe. Very little, right? I mean, you don't want to go overboard with this because we're going to use tumescent. Okay? And then I have standard tumescent solution, and just if you guys don't have Malamed's book or any other book about anesthesia, if you use 2% lido with 1 to 100 of epinephrine, the maximum dose is about 7.7 milligram per kilogram. If you do mesocaine, if you have, for example, a 75 kilogram patient, you have 1 vial of lidocaine. Actually, let me start here. You have 1 vial of lidocaine, which is 20 cc's. You have about, of 2% lido with 1 to 100 epi, you have about, what is that? You have 400 milligram of lidocaine. So that divided by 75 or 78 kilogram, you're at 5.5 milligram per kilograms. So you're safe, okay? You can use a whole vial of lidocaine. So do the math and make sure you're safe. So I already injected with lidocaine. This is a little long here. Thank you. And you can do it with a smaller cannula. I just have these available. And she has a lot of scarring, so there's a lot of scar tissue to break through. And I might use the 18 gauge just to do some hydrodissection using this here. You can use also a blunt cannula. So this is tumescent now. This is not pure lidocaine. Okay, good. I just want some hydrodissection here.
We have a question from the audience. A question from the audience, Daria.
Yeah.
would this address the dog ears from a procedure such as a platysmoplasty? I have observed this deformity and many do not want an invasive procedure. Thank you.
Don't worry about it. There you go. So dog ears, I mean, depends. If the skin is the issue, then of course not, right? And she has a lot of scar tissue here, so it's hard to break through here.
Yeah, I would agree with you. If the patient already agreed to a platysmoplasty, I think a small skin resection is really a minimal issue.
In her, this is not
Right.
more of a dog ear issue. Hold this top part here.
Oh, not for this patient, but just in general. It's a general question from the
There you
audience.
go. Yes, so if a dog ear is caused by skin excess, then you have to do excision. If you consider this a dog ear, which is more a volumetric issue, then you could do radiofrequency assisted lipocoagulation.
Yeah, and for tummy tucks, we all have dog ears at some point or another, and I find that using the RF, devolumizing it at the same time will actually reduce the amount of skin I have to ultimately take out, which is nice.
Mm-hmm. So hold this here. So I'm just trying to have my assistant hold this so I can guide this cannula. There you go, just to break through the scar tissue. Remember guys, normally it's not this hard, she had 2 prior surgeries. So as you know, Chris, the adhesion and the scar tissue, really you have to break through, but that's important, by the way, especially when you when you want to pass your FaceTite or AccuTite probe. You have to free up these interseptal network and tissues so you can freely move your probe to get good coupling.
I agree, couldn't agree more heartily. And I think pre-tunneling, since you mentioned it, is an important concept even in, say, primary cases such as males. I think it helps to, as you mentioned, redrape the fabric of the soft tissue, if you will, when it contracts.
Yes, and so here in the lower face, when you can see now comparison to the chin area that I was struggling with, it's much easier. Look how freely it goes through. And, you know, there's the chart in my presentation about the amount of tumescent. I really don't necessarily look at the amount while I'm doing this because by now I have a feel for it, but if you're a beginner, just make sure you don't over tumescent or under tumescent, just because you want to make sure a patient is comfortable. And 18 gauge.
As a face-up surgeon, do you feel comfortable doing an open case, say 2-3 years after an RF case? Is that different for patients that you've seen referred from elsewhere that you didn't do the energy? Do you find the planes are altered at all, or is it operator dependent?
You know, it's a great question because on a lot of my RF patients that I had done RF and then later on I did a facelift, I didn't really notice a big difference. I
would agree with you.
I really didn't see. So there is this myth that's going around that you're eliminating through the RF the subdermal plexus, but that's not true. You're actually inducing a higher production of VEGF, which is vascular endothelial growth factors. And also studies like with Morpheus has shown that you're increasing the lymphatic drainage. So you're actually creating the opposite. So a lot of things are indoctrinated. Someone said something at some point. There's, you know, not backed up with science, and now it's become a myth or a fear. So it's a telephone game. So that's why it's important.
I think it originated from the damage of the subdermal plexus from laser, and that it was conflated with any energy association.
Correct. So, and that's why we really shouldn't extrapolate data and information, because it significantly changes the options that you have, and you don't want to create rumors based on just extrapolation or dogma. So that's a great question. You know, there is some prominent people out there have made comments about this, and unfortunately you have to be very careful, especially if you have a big voice in the community. Can I have another one? to make comments like that because they could be deceiving. So our patient here is comfortably sedated. Again, you don't need sedation. We just offered her sedation and she accepted it. If we can now do this area, Brian. So I'm done with the lower face. I'm finishing it up with the nasolabial fold here. Thank you. And you don't have to use this big cannula here. You can use a smaller, you can use the same cannulas you use when you do filler injections. That works just fine. I just do it out of convenience because I don't like to switch between different stuff. So do what you deem most appropriate. All right. And again, for her, the Morpheus that we're going to add to this is purely for the purpose of tightening of the mass and some lipocoagulation, not for skin resurfacing. So I don't want to get close to the epidermis. I'll use burst mode, higher doses, because I'm not close to the epidermis. Perfect. Okay, so for the sake of time, we're just going to complete the right side so you can see it. And of course, we're going to finish her off with the left side, but that way you can see the right side and one complete side.
Thank you for that.
Yeah, so I'm going to be ready now for the, I'm going to actually use the AccuTite probe for her. So if I can have the AccuTite probe, Brian, that would be great. And then I'm going to also do the FaceTite. So I need an AccuTite probe and a FaceTite probe and a Morpheus 3D, and we're going to fire up, hook it up to the Embrace.
Can you again talk about what you're using for sedation?
So for sedation, again, you know, as an oral maxillofacial surgeon, I'm trained in anesthesia, so I'm certified and trained to deliver anesthesia. There's different ways you can do. You can do nitrous oxide. You can do Pronox. Works 90% of the time, okay? Again, what I'm doing now is for sake of convenience, just because what I do every day. So I used for her some Versed, some fentanyl, and this procedure does not require anything more. You can just do it with some Versed. You can even do it with Halcyon, which is PO sedative. You can even use Halcyon. You just have to make sure you give it to them an hour prior. And as far as nitrous oxide, you know, make sure you do pre and post operative oxygenation. So Brian, why don't you get me those probes, please, and so we can get started. So with this type of sedation, if I leave her alone, she's very comfortable, but I can wake her up, okay, anytime I want. So I just want to show you the AccuTite probe, the difference between the two probes. The AccuTite is very good. It fits well in the hand. There you go. So it fits very well in the hand. It's very handy, and you know, you can maneuver it in small areas, nasolabial folds, even lower face. And this is the area that I want to get, so I love the AccuTite probe for that. So if we can, it's just hooked up here. Here we go. Stand up. Okay. So give me a towel clamp here so it doesn't. And then give me the FaceTite probe. I want to put them side by side so people can see. What you need to know, you can just deliver energy deeper using the FaceTite compared to the AccuTite. And we're going to hook that up later. So here are the two probes here. Okay. So this is like an 18 gauge, 22 gauge, and the negative probe.
The length of the interior probes are 10 and 6 respectively.
Yes, correct. Yes, 10 and 6 centimeters. And then this is the negative, so from energy flows from positive to negative. This here that lays on the skin, you have to make sure you get good contact with the skin. And also a lot of times what I see beginners do, what I did a lot, I'm going to show it like this. All right, so when you hold it, you have to make sure it's aligned. So don't do it like that. Sometimes as you're in there, it gets caught up in some fiber septae and then you're not really delivering energy. So when people tell me, hey, I did FaceTite, I did AccuTite, it didn't work, I really have to see how you're doing it. First I look at your energy level and then the technique. So the technique, again, is like riding a bicycle. Like anything we learn, we have to practice and then we eventually become masters. Okay, this is the pedal. Okay, so if you can get that started. Brian, you can go to the other side and get the machine fired up. And we're going to use some, Tatiana, you can come over here and get me some gel. So the gel is important for the conduction and also helps prevent, that's okay. Just give me some 4x4, please, gauze, and give me the gel. It's in the bucket there, in the bowl. Yeah, hand it to me. So this is just some sterile gel and lube. It's actually plenty. Usually don't need that much. So I just put it in the areas that I want to treat. Okay. I'll make sure we don't move it. So we want to put it into the up. Yeah. Good. So if you look at the settings now, my typical settings are 60-42, so let's go 42 for her. I'm going to go a little higher and go 70 on the internal cutoff. This is the internal temperature. And just do the treatment time, just, I don't know, 90 seconds, 120 seconds. You know, that just after the time where it cuts off, it really doesn't matter because you're stopping anyways. And then hit the start button. So we can get started here. So by now the tumescent has worked. It's about 10-15 minutes where I usually wait. And so this is going to be a little tricky to insert it. There we go. All right. So sometimes what I do, I just tunnel. Lift your chin up for me. I tunnel a little bit just to free up things. There we go. And if you poke through the skin, it's all right. Remember, it's like a 22 gauge needle. And the reason why the tunneling is important, because you want to be able to glide it freely. You don't want it to get tied up. Okay. And again, you have to be carefully cognizant of the marginal mandibular branch going up. So I'm going to stay lower, and that's why I'm using the AccuTite. So you can do a stamping technique, which is what I'm doing now. Or
you're an advanced user, so for those of us who don't do it as frequently, we recommend the gliding technique first.
Yes, correct.
And then, of course,
and then the typical, so the gliding technique you want to do, you basically gradual speed, okay, not too slow, not too fast. I don't know how many seconds per centimeter that is, but I'm sure there is a reference.
I find that the 16-watt AccuTite, because it's a smaller surface area, heats up even faster than the 20-watt FaceTite.
Correct, because there's less impedance to travel through.
Yeah, it's super fast.
See?
So from a practice management standpoint, if you're doing jowls and neck, obviously for today's demonstration purposes, we want to optimize the instrumentation, but you typically use a FaceTite for the jowls and the neck, so you don't have to open a second disposable.
Correct. And I'm just doing this, Chris, for demonstration purposes, because I want to the audience see both, but you're absolutely right. You don't want to be wasteful, open up multiple. Right. So these beeps here, so if you've seen there, my internal cutoff, you know, I'm already used to the sound. the machine is behind me. I really don't need to see it. Maybe I can see it on there. Okay, so boom. So I really care in her about the internal temperature. I don't care so much about the external temperature. I'm not doing any resurfacing on her. You know, and the darker the skin, the smoother the skin, so you don't have to worry much about resurfacing. The sound that you just heard, that was a surge.
You're therapeutic on both, so that's great.
Okay, boom, that's my target temperature. And another thing, you don't want to get close to your entrance because you're more superficial here, so you can cause more dermal or epidermal damage.
Yeah, thanks for mentioning that. Also, how deep are you with the internal probe, would you guess?
With the internal probe, I'm anywhere between about a centimeter to a centimeter and a half, depending on the area of the skin. So let's clean this up just because, there you go. All right, so she's really numbed up well. I don't know if you can see it there, my hand is in front. And perhaps, all right. Give me some slack here. I'm gonna try to do it so the audience can see. All right.
So relative to the fold itself, Daria, you're slightly superior, would you say?
Yes, so that marking is about, I would say, a centimeter to 2. See, that's the temperature surge. That just means it heat up too fast, okay? So it protects it because it wants to prevent a burn. That's how smart this CPU is. Of course, you still have to know what you're doing, but you don't have to fear that you're going to burn something because it cuts off. Boom, right there, okay?
As far as endpoints, are you a kilojoules doctor or a time and temperature doctor? What is your preferred endpoint?
Oh, you just opened up a can of worms here.
Yes,
I knew
10
that.
docs
I
to
was
get
surprised
50
that question didn't come sooner. It's actually the most commonly asked question. So I really don't pay attention to the kilojoule. You know, if you look at the effects of this treatment, it's really time is the most important factor and the temperature. So I really pay attention to time and temperature. And anytime I do it based on time and temperature, when I look at my kilojoule, when I look at my kilojoules, they're always almost exactly the same, which tells me I'm doing the proper treatment as opposed to consciously looking at the, let's hook this one up, I'm looking at the kilojoules. So if we can just change to the FaceTite because I want to show the FaceTite. So go to main menu before you undo it. Let's go to bottom, yeah. So always go to the main menu when you unplug something. So unplug it and plug this one, please. Hand her the FaceTite probe, Brian. Okay, and undo that, please, so I have more room here. Just undo that. Thank you. Here we go. Perfect. All right.
Oh, for the audience member who asked who the host was, my name is Chris Chia. I'm off camera, which is probably best that way.
Do 42.
Joined by Lisa Mettler, Justin
68.
Ross, and Ryan Windes.
All right, so with the FaceTite probe, I like to start at the border of the mandible. So usually I put my technique is I put my finger under the border. It gives me a good reference because when you do tumescent, you cannot really know anymore. So put some more gel on there, please. And then when you initiate it, usually I couple it, I put it down, I hit it, I wait 1 second, and then start drawing back. And I don't know if you can appreciate the popping sound, which is basically the lipolysis that's taking place. Now, I'm doing it this way. What you want to do in the beginning, you really want to enter the FaceTite probe from this way. As a matter of fact, let me just do it so nobody gets confused here. You know. Thank you for illustrating that. Yeah, I'm you know, you know. Yes. So let's do this conceptually. And that's just so you don't heat up the no-fly zone accidentally. And it's just, it's hard. It gets really slippery with the gel here. Let me just wipe it off. There you go. And then you have to give yourself some traction.
Surgery, traction, counter-traction, right?
Yep.
In terms of higher Fitzpatrick types, the bipolar, I like to call these things the bipolar devices, are truly colorblind because they're not ablative. And
yes, they're not, exactly. And because they don't target pigments, it's not like laser. And so the only thing you have to worry about is heat on the epidermis, because extensive heat can cause post-inflammatory hyperpigmentation and activation of the melanocytes that could cause hyperpigmentation. You know, so anybody that ever like burnt their skin on a stove or something knows, and is colored like I am, knows what I'm talking about, and it takes literally 6 months to a year for that hyperpigmentation to go away. And
I just burned my forearm taking something out of the oven.
You're right. Yeah, for the grill masters out there and the chefs out there, y'all know what I'm talking about.
And like a Fitz 5-4. So.
I know.
Regarding the marginal branch, pearls and pitfalls for safety. What do you do if you do see a neuropraxia? What is a typical course? What do you think?
Yeah, I'll share you my first time I got a patient with neuropraxia. I didn't go into the no-fly zone. I made all my marking. Despite that, I got some neuropraxia, which is usually heat-induced. So one way to prevent it, I'm just not too aggressive in this area. Just right behind, and my marking just disappeared now. But it would be this area. So that's why I actually put my finger there, so I don't lose a reference. And when you do that, you don't run into that. But if you do get that, understand that it's temporary, okay? I've never heard, whether myself or anyone, report a permanent neuropraxia. And it typically lasts about 2 months in most severe cases. But usually they resolve within a couple of weeks. What I do, I give them a Medrol dose pack. You can give them some prednisone. But, you know, this is not really based on any data that I could show.
I agree. My experience is exactly the same. I would say without energy, the literature reads about 1 out of 2,000, 1,500 cases you get a temporary neuropraxia. By definition, it's a grade 1. If it comes back, it's got. And if you affected with energy, whether it be light energy, RF, or other, it's not going to come back. So thankfully, I don't believe that's the case. And the further, in my experience, having done a lot of local lipo neck without energy, before it got into energy devices, I still had this similar incidences. I think it's a stretch neuropraxia. I was messing a lot more aggressive in the old days.
It could be, right? Yeah, it's just, you know, again, it's so rare. I think I've done hundreds of these, and I think I had like 3 total maybe.
Yeah.
And the first 2 were like in my first like 10, 20 cases, which is testament to the fact that I was a rookie. We all started, I always tell my kids, we always start as a rookie. Doesn't matter how good you are. We all start at point 0.
My old chairman used to say, if you don't have any complications, you don't operate, you're a liar, or you're both.
Or you haven't done enough.
Right.
My mentor, Dr. Marks, used to tell me, is like, if you don't have any complications, that means you haven't done enough. So I'm getting 3 beeps pretty much in all the areas. Let me see how much we used here. 1.1 kilojoule, that's pretty good.
Another question here. In some cases, it's very difficult to achieve external temperature 35 to 42 because of internal cutoff of 68 to 70, even when passing the probe quicker. Do you have any advice which temps are most important?
Yes, it's actually a great question. The most important temp is the internal temperature, guys, okay? Don't worry so much about the external temperature, at least I don't, unless I want to have a resurfacing effect of it, okay? Now, if you look at her skin, she's very smooth. I don't care about resurfacing on her. What I'm trying to do is tightening the fibroseptal network and getting some lipolysis. So therefore, my target temperature that I'm looking at for her is the internal temperature. And you know what? Even if you reach the internal temperature, see I'm going back here now in their submental area. Once the tissue cools down, sometimes I go back. Now, I don't recommend that in doing in the beginning. You know, I kind of, based on my experience, I know what area would demand what, just because I've done so many, I've really experimented with this thing. I just want to give her the treatment that I feel is best for her. That's why I'm doing it. So that's why I put an asterisk on that. So now we can switch to the Morpheus body. If I can have a Morpheus body handpiece while I finish this case, and then in the meantime, you can come up with more questions. Tatiana, you can help her put the Morpheus body handpiece. Yeah, if someone can hand it to me, that would be great.
Well, Daria, I think you made an excellent presentation of Morpheus on the previous patient, and we're going to continue the full treatment off camera, but
yes,
I can't thank you enough on behalf of InMode University's educational series. It's been a real treat.
Thank you.
Getting to know you personally and professionally in a short period of time. I feel like we've known each other for a long time.
Right?
Yeah.
To be continued.
Yeah, we would love to come back. You're one of our
Thank you.
KOLs, and
Thank you.
we really appreciate your time and your excellent staff and even
Thank you
better
so much.
patients. And
I appreciate it, and thank you so much, everyone, for tuning in, and thanks to InMode for having me. I feel honored, privileged, and if you have any questions, you can always hook up with me on my social media channels for any questions, and I'll be glad to answer them.
And this content will be posted on InMode University's e-learning website for everyone to see and afterwards.
And please, there's plenty more videos. I tell you, I've watched all of them multiple times, and you can't learn enough. If you really want to get good results, if you want to become a pro, you must watch. And that's why I'm so excited to be here today, because I know how much it helped me. So I'm just passing it on.
Same here.
Thanks for tuning in.